look very good on her. Please welcome Dr. Marjorie Dixon to talk about pregnancy myths. I love this topic because if you were ever feeling lonely and you want a whole bunch of unsolicited advice, get pregnant.
Right,
People will come up to you everywhere and they will tell you all sorts of things. And some of these things are real and some of these things are myths.
Absolutely.
We're going to go through the myths right now. And a lot of these I believed or had heard. Myth number 1, queasiness and morning sickness will end with the first trimester.
What do you think?
I think that is a total myth.
Total myth.
That could go, it can go the whole time. And it's not always in the morning either.
But there's a reason why it's a myth, because generally speaking, the nausea and vomiting, this is what we call it, nausea and vomiting of pregnancy.
Yeah.
I don't know why people call it morning sickness. It's any time of the day sickness.
Yes.
It's middle of the afternoon, early morning, bedtime, middle of the night sickness. But it's because it's related to HCG, human chorionic gonadotropin, which is the hormone of pregnancy. When you pee on a stick or you have a blood test and they say you're pregnant, that's what's being looked at. And it rises rapidly initially in pregnancy. So as soon as you're pregnant, even when you're not very pregnant, you can feel pretty sick. And then it increases in intensity, kind of maximizing between 6 to 8 weeks, and then up to 10 weeks when the beta HCG level goes to its highest, and then it plateaus. So 12 weeks is at the end of your first trimester. And once it evens itself out, the body gets used to it. You don't feel as nauseous anymore. And that's also why when you have twins, you feel sicker sooner.
Right.
And there's a spectrum of sickness. So some people just have nausea, some people have nausea and vomiting, and some people have nothing at all.
Right.
So remember Princess Kate?
Yeah, Kate Middleton.
So she got really sick. She had hyperemesis gravidarum.
Right.
So there's a spectrum of how sick you can be. Every pregnancy is different, and everybody's different. With my first 2 pregnancies, not a second of sickness.
Really?
With my Gabriel, I threw up through 28 weeks, 7 months of sickness. So it really, I know.
My sister had that with both her babies.
Yeah, so it really
time.
depends on the individual and the pregnancy, but generally speaking, yes, you should have some relief at 12 weeks.
Right. And I remember I thought Kate Middleton was just being a princess. She actually was ill. Like she
was
had to
actually
be admitted to hospital
for hydration. It was bad.
Okay, the next myth. You will feel unattractive by the last month of your pregnancy and you will have no interest in sex. This is definitely false.
False.
Yeah.
False. What I've found when we used to have obstetrician clinics and gynae clinics to the end, and it was the partners who were worried about harming the baby during sex. So it wasn't the women were randy, the women were great and good to go, right? So they were like, I feel with, sometimes women just feel beautiful. You're growing a life and you feel like this is something that not everybody gets to do, and you're expecting your baby, and it was sometimes a moment that you never anticipated having, right? So love is what you feel.
That's right.
But it won't hurt the baby unless then your primary caregiver says there was a problem with the placenta lying low and you shouldn't be having intercourse or etc. So unless someone specifically says you should not be having relations, then yeah, it's a go.
It's a go. All right.
Green light.
If you get a lot of heartburn during pregnancy, your baby will have a lot of hair. So I heard this one a lot. I had no heartburn and my baby's full afros, both of them.
Okay, so
full head of hair.
This is why I love doing the show, because even with 14 years of postgraduate education, and as much as I knew this was complete myth, and in 2006, Johns Hopkins University in the States actually did a study, a prospective study looking for it. So it was well designed. When you're a doctor, you have to decide if the study you're looking at means something, and this one meant something because it was well designed. It didn't have a lot of patients, had 64 women, but they were blinded to what was going to happen. So they were actually supposed to assess themselves if they had none, minimal, moderate, or severe nausea. And then an independent coder, somebody else, after they had their baby, took 2 separate pictures of the baby's head, I swear, and then decided if the baby had little, moderate, more, or above average hair. And it ends up that the woman who had the most nausea in pregnancy had the hairiest babies.
So that's nausea, though. That's not heartburn.
Well, a heartburn, nausea, they coded
Same sort of thing.
They looked at heartburn, nausea in pregnancy.
Really?
I know.
Did you have heartburn or any of that?
I had none of that. None of that.
But you had hairy kids, didn't you?
No.
Oh. Well, I'm their head.
I think, actually, Nathaniel was almost hair-free.
Don't mean she had werewolves. That's not what I meant.
They were shaving. Yeah, no, I didn't have such hairy children, but I had no heartburn. actually.
Okay. All right. Well, I'm shocked
You learn
at that.
I know, shocking, but true.
Okay, I heard this one a lot. A glass of Guinness will help your milk come in.
Okay.
Everybody says that. That's not true. Isn't there something in Guinness or beer, like there's some element?
Okay, yes. So
helps
there
milk
is
production.
a polysaccharide in the barley in beer, dark beer and Guinness.
Okay.
That stimulates prolactin, which is the hormone that stimulates milk production.
Right.
However, there's also alcohol in beer and Guinness.
Oh gosh, yeah, I know.
Right.
That's why I was always like, is this right?
So that inhibits your milk production. And then
Right.
furthermore, we don't know, it gets transmitted in your breast milk, so we don't know what degree, there's no amount of safe alcohol. The pediatric societies do not recommend that we give alcohol to the babies.
While
right?
you're nursing.
Exactly. There are galactogogues or lactogogues, things that stimulate milk production. We've talked about those before, domperidone, metoclopramide, which if you see a lactation consultant or a physician about your low milk production, they will talk about those things and then prescribe them appropriately to help you get milk. As well, frequent nursing and then sometimes pumping. There are other ways of doing it that are safer for your baby than giving yourself beer. But if you do drink beer, it'll relax you.
And that might help with the flow.
But that can help with the flow, but it's not what we recommend for you to get your flow in.
Yeah, because if you're drinking enough that you're relaxed, there's probably something happening with your baby, right? Because the jury's out on how much they're actually getting.
Exactly.
So why roll the dice?
Exactly. You don't want to take the risk of putting your baby.
Okay, good myth. I like this myth debunking.
Isn't it fun?
Yeah, let's go to break. Dr. Marjorie Dixon, thanks a lot.